ये शुरू हो गया है। ये स्लाइड्स को नीचे करने के लिए बस यहाँ से ये रिज्यूम मैम यहाँ से होगा और ये स्लाइड्स यहाँ से चेंज होंगे बस खुल जाए फिर मैं वहाँ से स्टार्ट कर देती हूँ। डायग्नोसिस ऑफ प्रेगनेंसी से अब स्टार्ट करके ये नीचे नीचे जाते रहेंगे स्लाइड्स। इधर से आपको पॉज करना होगा जब भी, तो इस पे पॉज, ये रिज्यूम शेयर। अब मैं स्टार्ट कर रही हूँ वीडियो और ये साइड में छोटा सा दिखता रहेगा बस आपका ना, पूरा पीपीटी दिखता रहेगा। और जब एंड होगा ना तो फिर आप उस पे क्लिक करके और एंड वाला जो मैं रेड आपको साइड में दिखाई थी ना वो कर देना। इससे आप बीच में हम ब्रेक भी ले सकते हैं। मैं रिज्यूम कर रही हूँ।
So today our topic is diagnosis of pregnancy. The reproductive period of a woman begins at menarche and ends at menopause. It usually extends from 13 to 45 years of age. While biological variations may occur in different geographical areas, pregnancy is rare below 12 years and beyond 50 years. So Peru was the youngest one whose delivery is done by cesarean section at 5 years and 7 months of age. And the oldest one is at 57 years of age. So the duration of pregnancy has traditionally been calculated by the clinician in terms of 10 lunar months and 9 calendar months, 7 days, or 280 days, or 40 weeks. It is calculated from the first day of the last menstrual period. This is called a menstrual or gestational age. But fertilization usually occurs 14 days prior to the expected missed period. So in a previously woman with normal menstrual cycle of 28 days. So the fertilization age is calculated by subtracting 14 days from 280 days, that is 266 days. This is called fertilization or ovulatory age. So in the first trimester, that is up to first 12 weeks of pregnancy, the subjective symptoms are amenorrhea, morning sickness, frequent menstruation, breast discomfort, and fatigue. So the principles of immunological test of pregnancy, the pregnant woman should undergo the urine test, which contains HCG, or blood test, that is HCG anti-serum. So here is the neutralization of the antibody plus HCG coated latex particles. So there is no visible agglutination. In non-pregnant women, there is visible agglutination in this test. So the test includes immunological test of urine. So agglutination inhibition test, latex test, that the sensitivity of the test is 0.5 to 1 I per ml. That is urine test. The time taken is only 2 minutes. The inference is absence of agglutination, positive on 2 days after missed period. Direct latex agglutination test shows the presence of agglutination 2 to 3 days, and it is positive on 2 to 3 days after the missed period. It is also a urine test. So two-side sandwich immunoassay, membrane ELISA or card test. It is also a urine test. Here the color bands in control as well as in test windows. So on the first day of the missed period, it is positive. So various kits in card forms are available. Here the pregnancy test shows, the card test shows both control and test results are positive. In non-pregnant, card test is only control is positive. There is also ELISA test, which is positive on 5 days before the first missed period. So radio immunoassays are also available for pregnancy test. So the objective signs are breast changes are valuable only in primigravida, as in multipara. The breasts are enlarged and often contains milk for years. Montgomery tubercles are prominent. Thick yellowish secretion colostrum can be expressed as early as 12th week. As near the 5th week of pregnancy, the level of circulating prolactin begins to increase, eventually rising to approximately 10 to 20 times the pre-pregnancy concentration. So these are the changes in the breast. Here are the Montgomery tubercles and enlargement of breast nipple. So on per abdomen examination, uterus remains a pelvic organ until 12th week. It may be just felt per abdomen as a suprapubic bulge. So pelvic changes are Jacquemus or Chadwick signs. It is the dusky hue of the vestibule and anterior vaginal wall visible at about 8th week of pregnancy. The discoloration is due to local vascular congestion. Vaginal signs. The walls become softened. Copious non-irritating mucoid discharge appears at 6 weeks. There is increased pulsation felt through the lateral fornices at 8th week. It is called Osiander sign. Cervical signs. The cervix becomes soft as early as 6th week. That is Goodell sign. The pregnant cervix feels like the lips of the mouth, while in the non-pregnant state like that of the tip of the nose. On speculum examination, the bluish discoloration of the cervix is visible. It is due to increased vascularity. So on uterine signs, the size, shape and consistency changes. So the uterus is enlarged to the size of hen egg at 6 weeks, to the size of cricket ball at 8th week, and to the size of the fetal head by 12th week. The shape of the non-pregnant uterus becomes globular by 12 weeks. There may be asymmetrical enlargement of the uterus if there is lateral implantation. This is called Pisca-Sex sign, where one half is more firm than the other half. Hagar sign. It can be demonstrated between 6 and 10 weeks, a little earlier in multipara. It is based on the fact that upper part of the body of the uterus is enlarged by the growing fetus and the lower part of the body is empty and extremely soft, and the cervix is comparatively firm. Because of variation in consistency, on bimanual examination, the two fingers in the anterior fornix and the abdominal fingers behind the uterus. This is called bimanual examination. So the cervix is comparatively firm. Because of variation in consistency, the abdominal and vaginal fingers seem to oppose below the body of the uterus. Examination must be gentle to avoid the risk of abortion. Palmer sign. Regular and rhythmic uterine contractions can be elicited during bimanual examination as early as 4 to 8 weeks. During contraction, the uterus becomes firm and well-defined, but during relaxation, it becomes soft and ill-defined. While the contraction phase lasts for 30 seconds, with increasing duration of pregnancy, the relaxation phase increases. After 10th week, the relaxation phase is so much increased that the test is difficult to perform. So here is the diagram showing demonstration of Hagar sign. Here, per abdominal examination and per vaginal examination, the fingers will oppose at below the body of the uterus in case of pregnancy. So this is the graphic representation of the Palmer sign. At 4 to 8 weeks, the contractions decreases by 10th week. The contractions is 30 seconds and the relaxation phase is also small at 4 to 8 weeks, which increases to 90 seconds at 10th week of pregnancy. So in second trimester, which ranges from 13 to 28 weeks of pregnancy, so the symptoms will be quickening. Quickening is the feeling of life that denotes the perception of active fetal movements by the woman. It is usually felt to the woman at about 18 weeks and about 2 weeks earlier in multipara, that is 16 weeks in multipara. So the progressive enlargement of the lower abdomen by the growing fetus in second trimester. So on general examination, you can see the chloasma, that is pigmentation over the forehead and the cheeks. It may appear at about 24 weeks. The breast changes. Breasts are more enlarged with prominent veins under the skin. Secondary areola usually appears at about 20 weeks. Montgomery tubercles are prominent and extend to the secondary areola. Colostrum becomes thick and yellowish by 16 weeks, and variable degree of stria may be visible. On abdominal examination, during inspection, linea pigmented zone, that is linea nigra, extending from the symphysis pubis to ensiform cartilage may be visible as early as 20th week. Stria, both pink and white, of varying degree are visible in the lower abdomen more towards the flanks. On palpation, the fundal height increased with progressive enlargement of the uterus. The uterus feels soft and elastic and it becomes ovoid in shape. There is Braxton Hicks contractions. Presence of Braxton-Hicks contractions are evident. Palpation of the fetal parts can be felt distinctly by 20 weeks. Active fetal movements can be felt at intervals by placing the hand over the uterus as early as 20 weeks. So here is the diagram showing the level of fundus, the level of fundus of the uterus at different weeks of pregnancy. Note the changes of the uterine shape. Initially at 12 weeks, it is just at the level of pubic symphysis. Then at 24 weeks, it is at the level of the umbilicus. Then at 36 weeks, it is at the till the xiphisternum, and then again at 40 weeks it comes to the level of 32 weeks of pregnancy. So external ballotment is usually elicited as early as 20 weeks of pregnancy when the fetus is relatively small than the volume of the amniotic fluid. So you can feel the external ballotment in a 20-week pregnancy because the amniotic fluid is more and the baby is small. So it is difficult to elicit in obese patient and in cases with a scanty liquor. On auscultation, fetal heart sound is the most conclusive sign of pregnancy. Fetal heart sound is the most conclusive clinical sign of pregnancy. It can be detected between 18 to 20 weeks of pregnancy. The sounds resemble the tick of a watch under the pillow. Resemble the tick of the watch under the pillow. The rate varies from 110 to 160 beats per minute. Internal ballotment can be elicited between 16 to 28 weeks of pregnancy. The fetus is too small before 16th week and too large to displace after 28 weeks. So, internal ballotment is elicited between 16 to 28 weeks of pregnancy. The test may not be elicited in cases with scanty liquor amni or when the fetus is transversely placed. So here is the diagram showing external ballotment. The figure A and figure B and C is showing internal ballotment. Okay, so because of more liquor and small fetus, you can elicit both external and internal ballotment. So investigations during pregnancy. What investigation you can do during pregnancy? First is sonography. So routine ultrasound at 18 to 20 weeks permits a detailed survey of fetal anatomy, placental localization, and the integrity of the cervical canal. So the gestational age is determined by measuring the biparietal diameter, the head circumference, the abdominal circumference, the femur length. It is most accurate when done between 12 to 20 weeks of pregnancy. So biparietal diameter is measured at the level of the thalami and cavum septum pellucidum, and it is measured from the outer edge of the skull to the inner edge of the opposite side of the skull. So second is the fetal organ anatomy is surveyed to detect any fetal malformations. So the fetal viability is determined by real-time ultrasound. Absence of fetal cardiac motion confirms fetal death. So MRI, magnetic resonance imaging, can be used for fetal anatomy survey, biometry, and evaluation of complex malformations. So last trimester extend from the third trimester extend from 29 weeks onward till 30 weeks of pregnancy. Last trimester extend from 29 weeks till 40 weeks of pregnancy. So the symptoms are amenorrhea. The amenorrhea persists. There is enlargement of the abdomen that is progressively increasing. There is lightening At 38 weeks, especially in primary gravida, a sense of relief of pressure symptoms is obtained due to engagement of the presenting part. Frequency of micturition reappears. The fetal movements are more pronounced. The signs in third trimester are cutaneous changes are more prominent with increased pigmentation and stria. The uterine shape is changed from cylindrical to spherical beyond 36 weeks of pregnancy. The fundal height, the distance between the umbilicus and the ensiform cartilage is divided into 3 equal parts. If the head is floating, it is of 32 weeks of pregnancy, and if the head is engaged, it is of 40 weeks of pregnancy. So the symphysis fundal height after 24 weeks, the symphysis fundal height measured in centimeters corresponding to the number of weeks up to 36 weeks. Braxton Hicks contractions are more evident during last trimester. Fetal movements are easily felt. Palpation of the fetal parts and their identification becomes much easier. So this is the measurement of the symphyseal fundal height. So you can measure the symphysis fundal height. The fundal height is determined by measuring the distance from the pubic symphysis to the highest part of the uterus. A 33 weeks baby should measure 33 centimeters. Okay. So if the baby is 33 weeks of pregnancy, you can your symphysiofundal height should come by 33 plus minus 2 centimeters. This is the mid sagittal view of mother with baby in utero. So fetal heart sound is heard distinctly in areas corresponding to the presentation and position of the fetus. It may not be audible in case of obesity, polyhydramnios, occipito-posterior position, and certainly in IUDs. Sonography, gestational age estimation by BPD, HC, AC, and femur length is less accurate in third trimester with a variation of plus minus 3 weeks. Fetal growth assessment can be made provided accurate dating scan has been done in first and second trimester. So the differential diagnosis of pregnancy. It can be uterine fibroid, cystic ovarian tumors, encysted tubercular peritonitis, hematometra, or even distended urinary bladder can mimic pregnancy. The confusion is accentuated by the presence of amenorrhea for some other reasons. So the pregnancy may also coexist with these swellings. So pseudocysis, that is false pregnancy, it is a psychological disorder where the woman has the false but firm belief that she is pregnant, although no pregnancy exists. So it is called pseudocysis. Signs of previous childbirth. So the breast becomes more flabby, nipples are more prominent, abdominal wall is more lax and loose. There may be presence of silvery white stria and linea alba. The uterine wall is less rigid and the contour of the uterus is broad and round rather than ovoid. The vagina is more roomy. Cervix. Nulliparous cervix is conical with a round external os. In parous women, it becomes cylindrical and the external os is a transverse spatula slit. So, the estimation of gestational age and prediction of expected date of delivery. The patient's statement, date of fruitful coitus If the patient can remember the date of single fruitful coitus with the certainty, it is quite reliable to predict the expected date of delivery with the accuracy of 50% within 7 days on either side. Naegeli's formula, its prediction range is about 50% with 7 days on either side of expected date of delivery. The date of quickening, a rough idea about the probable date of delivery, can be deducted by adding 22 weeks in primigravida and 24 weeks in multipara to the date of quickening. Previous records. The required weeks are to be added to make it 40 weeks. A clinical examination. On clinical examination, size of the uterus prior to 12 weeks more precisely correspond with the period of amenorrhea. Palpation of the fetal parts at the earliest by 20 weeks. Auscultation of the fetal heart rate at the earliest by 18 to 20 weeks of pregnancy. On investigations, reports of positive pregnancy test. Ultrasonographic findings at the earliest are gestational sac at 5 weeks, measurement of crown rump length detected at 7 weeks, approximates 10 mm at 10 weeks. 34 mm. Okay, so measurement of crown rump length detected at 7 weeks, it is approximately 10 mm. At 10 weeks, it is approximately 34 mm. CRL in centimeters plus 6.5 is weeks of pregnancy. So the objective signs of pregnancy, the height of the uterus above the symphysis pubis in relation to the landmarks on the abdominal wall or symphysiofundal height. Lightening. Following the appearance of the features suggestive of lightening the labor is likely to commence within 3 weeks. Size of the fetus, changes in the uterine shape, volume of the liquor amnion, hardening of the skull and girth of the abdomen are of value in assessing maturity of fetus. Vaginal examination, if the cervix becomes shorter and dilated, the labor is fairly not far off, but labor may start even with long and closed cervix. On investigation, ultrasonography, gestational age determined by sonographic measurement in first or second trimester should be compared with the menstrual age. In clinical practice, when the difference between the two is less than 10 days, the EDD derived from LFP is confirmed. When the difference is more, the EDD should be based on ultrasonographic fetal biometry. So estimation of the fetal weight. Fetal growth velocity is maximum over 32 to 36 weeks of pregnancy. It declines gradually over 36 to 40 weeks of gestation. So the Johnson's formula, the height of the uterus above the symphysis pubis in centimeters minus 12. If the vertex is at or above the level of ischial spines, or minus 11 if the vertex is below the level of ischial spines. It is multiplied by 155. In either case gives the weight of the fetus in grams. So, on sonography, fetal weight has been estimated by combining a number of biometric data, that is BPD and head circumference. AC and femur length table, Hadlock's and Shefford are currently in use. It is computerized. Estimated fetal weight likely to be within 10% of actual weight. These are the formulas for estimation of fetal weight, that is Shefford formula and Hadlock formula. In Shefford formula, there is log 10 EFW grams equal to 1.2508 plus bracket in the bracket 0.166 into BPD bracket close plus 0.046 multiplied by AC minus 0.002646 multiplied by AC multiplied by BPD. This is Shefford formula. And second is Hadlock formula.
बेटा इधर आओ। तेरी पीपीटी की स्लाइड खत्म हो गई, पर वो ऊपर से जो तूने बताया था ना वो चल नहीं रहा।
पीपीटी में भी गलत लिखा है, सारी चीजें मैंने की, सारा गलत लिखा है उसमें।